professor and epidemiologist at the University of Ottawa. Good morning.
Good morning.
So in Ottawa here, nearly 80% of eligible residents are now fully vaccinated. How does that success square with what the advisory table is predicting that could happen later this fall, with daily case counts potentially rising as high as 9,000 by October?
Right. Vaccination is fantastic. It's our best tool, but it's not perfect, and we do need a very high number of people to be immune before we see substantial reduction in risk. And the reason for that is that three, four reasons, frankly. One is that Delta is a brand new beast. It's almost like a new disease in some ways. It's so hyper-transmissible and contagious, so it just tears through unvaccinated populations. Second reason is that 80% is a high number. It might not be high enough for the eligible population. Because Delta is so contagious, the threshold for even having the herd immunity conversation is now much, much higher. So nationwide and province-wide, we have somewhere between 60% and 76% of the total population fully vaccinated. That's not enough. Epidemics are about the size of the susceptible population, and we have a substantially large susceptible population that can still be seriously infected, therefore drive additional waves. And the final reason is that immunity is not evenly distributed across the population. So the unvaccinated aren't homogeneous. They are clustered geographically, and they're socially linked. So then when an outbreak does happen, it tends to tear through these little clusters in the population, causing some chaos in our healthcare system.
So I understand now the goal people are talking about is upwards of 90%. I'm wondering, is herd immunity even possible with Delta?
It's a good question, and no one really knows. We can get close. We can get herd effects, and that's all you need, really. Look, we have other diseases with us that we may not have herd immunity to, like chickenpox. There's some debate over whether chickenpox is truly, we're totally immune to chickenpox across the population, but we don't worry about chickenpox much. Rotavirus. We have a vaccine that doesn't prevent transmission, but rotavirus has been diminished by 90% or so, and it's not a serious concern anymore in hospitals. So it's possible to get such a high uptake of vaccines that this becomes a non-newsworthy event, as it will in a few months, I think. So vaccination is still our best way forward.
I like the sound of that. But so here's the thing. I see this disconnect. We see case numbers rise, but then I look at who's in the hospital, or how many people are in the hospital, or even more interesting, how many people are in the ICU. Can we expect the kind of pressure on hospitals and ER departments that we saw in previous waves?
That's a really good question. And the answer is we probably can expect some pressure on it because, again, the unvaccinated population is exactly the same as the population a year ago when we had no vaccines. And they are still a substantially large population. And given the rate at which Delta tears through that population, we can have a large number of them in the ICUs quickly. That's why we have to make some choices right now to slow transmission while we force vaccine uptake as high as we can get it. So yeah, the risk to the hospital system is still quite high, especially given that we have fewer healthcare workers today than we did a year ago.
I know Delta is exponentially more contagious, but do we know if it is as severe or deadly as earlier variants?
Really good question. We don't really know. So there are some studies suggesting it might be, but they're inconclusive. It's just that the hyper-contagiousness of it means it affects more people. Therefore, even if the same proportion end up being hospitalized and die, that's a larger number overall because more people are affected overall. And we see that children are now being affected, especially in U.S. hospitals. And it doesn't mean the virus has changed its focus. It's just that the children are the single largest block of unvaccinated people, so we're going to see more of them affected.
You know, the plan for a vaccine passport here in Ontario led, according to the ministry, to a jump, like a doubling in the number of people signing up to get their first shot, which is exciting. And in that sense, it's working. But how far do you think that carrot or stick, depending on your perspective, will go?
Some policy analysts suggest somewhere between 5 and 15% of additional vaccination, which is great. The thing about the vaccine passports is they target only one contingent of the vaccine hesitant. So amongst the vaccine hesitant, there are the anti-vaxxers, who are a rabid, almost religious group. There are those who are simply scared of the vaccine and they need some education and some time with healthcare workers to have a conversation. There are those who can't access the vaccine because of lifestyle considerations. Maybe they can't get childcare or time off work. And then there are those who are simply apathetic. They have nothing against vaccination. It's not a priority for them right now. The vaccine passports incentivize that last group by giving them a reason to seek vaccination. And that they're not the majority of the vaccine hesitant or the vaccine resistant, but they're a sufficiently large group that I think is going to have a big impact on vaccine uptake.
What a real ripoff is that 20% of the new cases are people that are fully vaxxed, these breakthrough cases. Does that surprise you, that figure?
No, it doesn't. First of all, we expect some breakthrough cases, and maybe we should call them spillover cases instead, because a breakthrough suggests there's a wall of immunity that we're bursting through. And that's not true. The wall of immunity is still standing. It's just that some are spilling over because there's so much virus circulating. We always expected that because sterilizing immunity is a rarity in vaccine science. And sterilizing immunity is the kind of immunity you get that prevents infection in the first place. What we always expected was the vaccines would be good at preventing serious disease, hospitalization, and death. And they still do to a high degree. So put that aside for a second. The next thing is that as more people get vaccinated, we expect the number of cases represented in the vaccinated population to be greater. That's confusing. So the analogy I give is seatbelts. So if we have 100% of drivers wearing seatbelts, the number of fatalities caused by car crashes will come down, but they won't come down to zero. But those few that do happen, 100% of them will be among seatbelt wearers. Doesn't mean seatbelts don't work. It just means that more people are seatbelt wearers. So as more people accept vaccines, those cases that do happen will be ratcheted up to be more vaccinated. If that makes sense to you. We call this the base rate fallacy. It's a statistical illusion. So I'm not overly concerned when I look at the infected population and see a proportion thereof that are vaccinated. I'm more concerned when I look at the proportion of the vaccinated who are infected versus the proportion of the unvaccinated who are infected. And frankly, the unvaccinated, the risk of being infected, profoundly higher, many times more higher. So vaccination works to prevent infection to a large extent and definitely to prevent serious disease, hospitalization, and death.
Raywat, thank you so much for your time this morning. As always, it's really illuminating to speak with you.
Thank you very much.
That's